Um, it's my pleasure to welcome us all to tonight's meeting, wherever it is that we are joining in from, maybe joining live or we actually are watching a recorded version of tonight's meeting. What I is you are in line to be impacted with knowledge. You are in line to be impacted with insight. You are in line to receive instructions that can bring liberation to your health and to your life and your well-being and your happiness. If information that can liberate you or elevate you to new levels of happiness in life. So tonight, I'm honored to be your host. My name is Ade Dolamushubawale. My friends call me Ade. I'm a wellness enthusiast and other things that I do. I'm an entrepreneur as well. And tonight we have an erudite scholar, a perfect gentleman, a professional medical person in our midst to discuss the critical issue of dementia. So I believe that for the next 30 seconds, while I introduce the speaker, you want to do yourself and your friends, your family, your neighbors a huge favor by going on right now to remind them. And I'm so sorry. Network just has decided to take its toll on me tonight. But we shall overcome and we're going to go forward. So I was just saying the Professor Dr. Emeka is the head of department for psychiatry and mental health, David Umahi Federal University Children's Hospital Uburu, and he has worked with CDM International for about 10 years, where he's represented CDM's interests in West and Central Africa. He's worked to integrate mental health into general care, during which he supported countries in the region to develop mental health care. He later worked with MSF France, that's Medicine Sans Frontières, Doctors Without Borders, France, before teaching mental health and psychiatry at the Imo State University, Owerri. Dr. Emeka Nwefo is widely traveled as he has visited over 40 countries in 4 continents. He is married and is blessed with 3 children. So, ladies and gentlemen, I'm sure you'll agree with me that we have a very, very important personality amongst us tonight. And to welcome him, I'd like us to drop, your hottest, your most favorite emojis in the chat room. Just drop some emojis. Let me know that we are together tonight on this platform. Let me see your emojis, either your fire emojis or your hug emojis or your thumbs up emojis. Let's create an atmosphere to make welcome Dr. Nwefo tonight. Thank you very much. Emori Philomena, I see you. Thank you. Let's do more. I want to see more emojis to welcome our doctor to tonight's platform. Okay, let me try this now. Let me see emojis from Abigail, from Adedoyin. Let me see emojis from Bruno Tina, from Christopher Ofuani, from Columbus Uche. Emojis from Arua, Ekene Dilichukwu. Emojis from American Nwefo himself. If he wants to give me an emoji, you are welcome to do that. Etudo Ibukun Faloyi. Ladies and gentlemen, without much ado, let's make welcome right now Dr. Emeka Nwefo to the platform. You can take the floor, sir. The floor is all yours. Thank you so much for your... Thank you, sir. You're welcome. It's good to see you. You need to unmute yourself, sir. You need to unmute yourself so we can hear you. We can see you, but we cannot hear you, sir. You need to unmute yourself.
All right. Thank you.
Yes, now we
Thank
can
you
hear.
very much. Yeah, thank you so much. I'm so excited to be with you this evening. I feel so humbled to be in your midst. When I got the invite, I said, yes, this is really one of the things I enjoy doing most. I thank the organizers of this program for finding me worthy to share this with you. So thank you so much. Um, okay, okay. I'll now share my slide and start. Thank you once again. Um, just 1 minute. Let me share. Let me make a slideshow. All right. Yeah. Thank you. We will be discussing demystifying dementia. It's a life decision that you can make today. Really, I know no one will be happy to have an illness, especially of this type. So we want to defy it. We wouldn't want one to have it. So we're going to be discussing strategies that will help us defy dementia, not to have dementia. All right, I'll start with a case weakness of Mr. J. Before I start, I want to say that I have no conflict of interests. There's really nothing. This is most of this I got from my work and from the on referral by a family physician. His wife claimed that Mr. J had become so forgetful that she was afraid to leave him alone, even at home. And then Mr. J retired at the age of 62 years after experiencing a declining in work performance during the previous 5 years. He also slowly gave up hobbies he once enjoyed, hobbies like photography, reading, and golfing, and became increasingly quiet. However, this growing forgetfulness went unnoticed at home. Then one day, while walking in an area he knew well, he could not find his way home. From then on, his memory failure began to increase. He would forget appointments, he would misplace things, and lose his way around the neighborhood where he resided for over 40 years. He failed to recognize people, even those he knew for many years. His wife had to start bathing and dressing him because he forgot to do this by himself. Examination of Mr. J revealed that he could not recall the time or place where he was. He was only able to recall his name and place of birth. Mr. J seemed lost during the interview, only responding to questions with an occasional shrug of his shoulders. When asked to name objects or to recall words or numbers, Mr. J appeared tense and distressed. Mr. J had difficulty following instructions and was unable to dress or undress. His general medical condition was good, and laboratory examination showed abnormalities on Mr. J's EEG. EEG is electroencephalogram, and CT scans. That is about Mr. J, who had dementia. And just as a simple definition, dementia is an umbrella term. It is not just it's a collection of symptoms that is caused by disorder, and they are caused by disorders affecting the brain. It is not just one specific disease. It is a collection of disorders. Dementia affects thinking, affects behavior, as you can see with Mr. J, and ability to perform everyday tasks and brain functions. Brain function is affected, and it interferes with the person's normal social and working life. The most common type is Alzheimer's dementia. I know that this is the one so many people know about. Alzheimer's disease, Alzheimer's dementia is the most common. And it affects approximately about between 40 to 70% of all dementias. Thus, about 40 to 70% of all dementias is accounted for by Alzheimer's dementia. So close to a third, in fact, over a third of all dementias can be affected. The next in line is vascular dementia. It is second most common, and it accounts for about 15 to 25% of all dementias. While others like Lewy body dementia, sometimes we may not hear about this. It accounts for between 2 to 20% of all dementia. Then frontotemporal dementia and all the others, dementia in Parkinson's disease, dementia in Huntington's disease, head injury, dementia from head trauma, dementia from HIV, alcohol-related dementias, and so many other types of dementias. So many. We classify dementias into progressive. Some can be progressive, that is, they start and they continue to get worse, as you can see in the Mr. J. While others can just be there, non-progressive. They just start and they remain as they are. While some are reversible. Several, and the reversible one, meaning that it can be reversed. The effects, the memory effect, and all the symptoms, some of the symptoms or all the symptoms can be reversed. The reversible dementias include vitamin B12 deficiency, elevated cholesterol, thyroid problem, dementia caused by diabetes, dementia caused by infections, carbon monoxide, brain tumor, and medications like anticholinergics. These are reversible. When you treat the condition, the person can go back to normal functioning and memory functioning. As I said, the most common is Alzheimer's dementia. And many people that you see may have this. And the symptoms include confusion and with time and location. That's why they miss their location where they are. They miss their way back home. They can just stray away into the streets and not able to find their way back home. There's also difficulty completing familiar tasks, what they used to do, like bathing, dressing themselves, difficulty solving problems, memory loss, misplacing items. Sometimes they misplace items in the house and they're looking for it and accusing people of taking things from them. Their judgment may be poor, and they also may find it difficult finding words to describe what they feel. Some withdraw from social activities and begin to stay indoors. These symptoms we saw in Mr. J as indicates weakness. Dementia is different from normal age. There are so many differences. A lot of people think that when someone is aging, they mistake dementia for normal aging and think that aging people, or when they start seeing symptoms of dementia, they believe that this person is aging and shouldn't be cared for. They wouldn't need any care, any need. to go to the hospital. In normal aging, the person is still able to pursue his daily tasks. He's still able to function effectively in his function independently. Whereas in dementia, the person finds it difficult to function, to do the daily tasks that he's used to, like paying bills, like dressing appropriately. Some that have dementia, you may see oil stains on their body. They don't, then they may not be able to wash up, take their bath, as we saw in Mr. J. They become forgetful. They may require time. Normal aging without dementia may require some time to remember directions and or navigate their ways. But people with dementia get lost in familiar environments. So many other reasons, as in this slide. People with dementia are able to recall, people without dementia, normal aging, are able to recall and describe significant events and instances. But this is impaired in persons with dementia. So dementia is different from normal aging. I think there is this discourse that is unending about nature and nurture in dementia. Really asking the discourse or the debate is so much about what causes it. Is it nature? Is it just you are born with it? Or is it nurture? Is it environment? Is it your diet? What are the possible causes? Lots of people have have done a lot of research to want to advance the debate. Some scientists seem to agree that both genetic influences, that is what we are born with, and environmental influences, what we're exposed to, our culture, where we live in, the food we eat, both of them play a role in dementia. And the genes definitely play a role in Alzheimer's dementia, really. But however, recent report estimates that genetics currently explain only about a third of Alzheimer's dementia. That is a study done by Ridge et al. In 2013. Thinks that genetics plays very little role in Alzheimer's dementia. as more as a third. That's about 33%. And a larger part of our risk for eventual developing dementia actually comes from the environment, meaning that up to over 60% actually comes from environment. So there is a growing body of evidence that through healthy life choices, we can indeed have some impact on our brain health. Saying that if making life choices can actually impact on the brain health, on dementia. As you see, about 40% of dementias could be, now mainly we are talking more of Alzheimer's dementia, it's preventable if we address lifestyle factors. And these lifestyle factors, it can include increase in education, increase in physical activities, increase in social contact, and decrease hypertension, decrease obesity, decrease smoking, depression, diabetes, decrease in excessive alcohol use, and head injury and pollution. These factors can increase possibility of developing dementia. So it's our choice to treat, to prevent, or to delay development of dementia. But we must know, of course, prevention is better than cure. That is what we are taught in school then. And drugs for treating dementia are really of limited clinical benefits. Hello? Sorry, are we together?
Yes,
Hello?
we are. Together.
All right. Sorry, I had. Yeah. We are saying that it's a choice to treat, to prevent, or to delay development of Alzheimer's dementia. And we're saying that drugs for treating these dementias are of limited clinical benefit. And so we do not treat underlying causes. It does not treat the underlying causes. So prevention is what we really want to, or postponing the onset of this dementia and then delaying or slowing its progression. This appears to be a better option that will lead to better improvement in health status and quality of life in older age. That is actually the reason for this discourse. I'm going to take you through very few studies. There are lots of studies that have shown what we just talked about, that prevention is possible, and identified areas that we can work on and prevent development of Alzheimer's dementia generally. One is found that deficiencies of vitamin B, including folate, vitamin B6, and vitamin B12, and elevated homocysteine levels, they have been associated with increased risk of cognitive impairments, Alzheimer's dementia, and vascular dementias. This was by Herman and Obeid in 2011, found this. And also, same people, Herman and Obeid, also said that elevated homocysteine may also increase oxidative stress and the production of beta amyloid plaques in the brain. So you can still see increased homocysteine and deficiency of vitamin B vitamins. These two, we should just note them. Also, other studies have continued to look more closely at homocysteine, high level of homocysteine. And then also some looked at diabetes and major depression and linked them to causation of Alzheimer's dementia. Diabetes, especially there is type 1 and there's type 2 diabetes. Type 1 diabetes is the one that is early onset, the one that is seen more, it starts early in children, but type 2 diabetes, that's type 1 is also called insulin-dependent diabetes. But type 2 is the one that is more in adults. It's called non-insulin dependent diabetes. And diabetes has been found, especially the type 2, with the metabolic syndrome. Metabolic syndrome can also emanate from diabetes and other illnesses, and that these appear to be risk factors for cognitive impairment and dementia. That's what one study found. And going further, meta-analysis was done, and meta-analysis means pulling so many studies together to see the weight of evidence. And that's now also said that diabetes may be associated with up to 47% increase in risk of dementias. 47, nearly half of all dementias, and 39% increased risks of Alzheimer's dementia, and a whooping 138% increase in vascular dementia. This was done by Lu et al. In 2009. So it's just saying that diabetes is a very strong factor in development of dementias, majorly vascular dementia that we saw, Alzheimer's dementia, and all dementias. Another studies, OMB, in 2006, associated through epidemiological studies, saw that depression was also associated with around double the risk of Alzheimer's dementia, depression. So we've seen depression, dementia, high vitamin B, vitamin B vitamins, especially B6, B12, folate, and homocysteine. These, and he went on to say that depression is associated with increased inflammation, and high cortisol, of course. And both of these have detrimental impact on brain structure and function. So depression is really highly implicated in formation of dementias. I have said earlier that dementia is not a normal part of aging. Although the risk of developing dementia increases with age, but it is not a normal part of aging. Now, many nutrients, both micro and macro nutrients and metabolic enzymes, are known to be essential to be substrate metabolism and energy transfer are known to reduce with age. But deficiencies in a number of other nutrients have been observed in patients with dementia. And these include omega-3 fatty acids. I think we really need to take this research by Lope da Silva in 2013, that this deficiency of these vitamins, of these micro and macronutrients, omega-3 fatty acids, vitamin A, vitamin B12, vitamin D, folate, iron, vitamin E, and vitamin C. These are deficient. They are depleted in persons with, dementia. Also, oxidative stress. We have talked about this so much in this platform. Free radicals and oxidative stress can also have effects on formation of dementias, because these free radicals come from smoking, come from the environment, and they have a lot of influence in the causation. We have seen so many research done on this topic. We have to make inferences. And the question is, could cocktail of multiple antioxidants be beneficial in prevention of dementia? Should we just, if we bring so many antioxidants, because many of these deficient nutrients are also antioxidants. If we bring them together, form a cocktail, can they really be beneficial in preventing dementia? Or are there other ingredients that are necessary for prevention of dementias? We can infer from the studies that we've cited that to reduce dementia risk, we need to, 1, keep an active mind, keep fit and active, physical fitness, eat Mediterranean-style diets. We're coming to dwell more on these, but especially the Mediterranean-style diets. Look at our cardiovascular health, reduce risk of developing diabetes. We saw that diabetes really has a lot to do with development of dementias. Also reduce the risk of dementia, reduce oxidative damage, increase antioxidant enzymes, decrease homocysteine and cholesterol levels, manage blood pressure, and modulate inflammation. This is the meat of this discussion. Now, I think this is where we're going to really start to talk about how we can defy dementia. These are the key points that we really focus on in the next few minutes or so. Number 1 is that we must keep active mind. Someone told me that you use your brain. It's either you use your brain or you lose it. Use it or lose it. If you don't use your mind, anything you don't use, actually, you lose it. If you don't use your muscles, you lie down for a very long time on the bed, you may not be able to walk. The muscles become flabby. If you don't use your brain, you will start losing it. So mental stimulation activities is the exercise of the brain. Exercising your brain may actually promote greater connection between throughout the brain using it. More complex occupations and engaging in leisure, mentally stimulating activities are linked to increased cognition, and they protect against dementia. This was by Harrison et al. In 2015. So being active, the occupation, something that taxes your brain at any point. It's not just at childhood. Taxing your brain, that is what I think that you can see some of our senior citizens. One of our presidents has to go back to study PhD at 70. And if you look at him, you can see that he's still very, very much cognitively enhanced. So people going back to study, engage in academic or rigors that increase, that task your brain, are really very important. They help to keep the mind active. Also, learning something new greatly stimulates the brain. It may include learning a new foreign language, learning to play some musical instruments, or learning new crafts or techniques. These help to keep the mind active. Yeah. And others like reading books, very good books, and stimulating discussions with your friends. Stimulating discussions that will make you think, will also help keep your mind active and prevent dementia. Not just the mind, not just your brain that need to keep fit, but also your body. Physical exercise improves the function of neurotransmitters, particularly those ones that make you happy and strong. And these neurotransmitters that control memory and other cognitive functions, neurotransmitters like serotonin that regulate the mood, neurotransmitters that influence appetite, and that enhance sleep quality. So these help improve not just your muscles, but as you're doing physical exercises, your muscles and your brain also get stimulated and keep fit. But before we do this, we are encouraged to see your doctor, your healthcare provider, to be sure that you're not just jumping into exercise that may not be good for your body. Some people have been seen to have dropped dead when they're on treadmill. So your doctor will need to examine you well and ensure that this kind of exercise is what you can do. So meeting your doctor before starting or before increasing the frequency of the exercise or the exercise you've been doing will be very important. It's very necessary. This is really one of the Mediterranean type of diet is recommended. Research done by Gu et al. In 2011 says that dietary pattern is defined Mediterranean diet as dietary pattern characterized by high intake of fruits, high intake of vegetables, fish, nuts, and legumes, and lower intake of meats, lower intake of high-fat dairy, and low intake of sweets and sugars seem to be associated with lower risk of cognitive impairment and dementias. This was by Gu et al. So this is found, and another researcher, Ricci, in 2010, saw that increasing fruits, very similar to what Gu talked about, but increasing fruits and vegetable consumption and eliminating depression and diabetes are likely to have the biggest impact on reducing the incidence of dementia. Another researcher in 2011 showed that 88% lower risk of any dementia and 92% lower risk of Alzheimer's dementia in those with an overall healthy diet at midlife compared to those with unhealthy diets, showing that diets lower the risk of developing dementia so much, up to 92% Alzheimer's in people with healthy diets. And another Scarmets in 2007 also mentioned, said that adherence to Mediterranean type of diet may affect not only risk of Alzheimer's disease, but also subsequent disease course. That is the progression of the disease. So it will not, the Mediterranean type of diet will not only delay the onset, will not just reduce the risk, but it will delay the course, that's how the illness progresses. So what is Mediterranean diet? The principal aspects of this diet include, just in a nutshell, high consumption of olive oil, legumes, refined cereals, unrefined cereals, sorry, fruits and vegetables. Moderate to high consumption of fish. Moderate consumption of dairy products, mostly yogurt and cheese. Moderate. Moderate consumption of wine, and low consumption of meat and meat products. That's the Mediterranean diet. So let's just go down more into what it is. Let's now low saturated fats. You can see the foods that are we can describe as saturated fats: cheese, cream, palm oil, mayonnaise, ice cream. Low in that, but high polyunsaturated and monounsaturated fats. Rich sources of quality proteins, rich in essential vitamins and minerals, high in omega-3 fatty acids and low in omega-6 fatty acids, high in dietary fibers, high in antioxidants, and high in polyphenols and flavonoids. This is the Mediterranean diet. You can see the saturated fat. You can see mainly nuts, avocado, and so on. These are very good. Fish consumption is really very good for protecting the brain, according to research. According to Carl Magin in 2000, said that high fish consumption tend to be inversely associated with cognitive impairment and decline. So if you eat more of fish, means that there is reduction in cognitive impairment and decline. That is now what will lead to dementias. And elderly people who eat fish or seafood at least once a week are at lower risk of developing dementias, including Alzheimer's dementia. This was by a study done in 2002. So fish and seafoods. Fish is a unique nutritional package. And fish is a predominant source of long-chain omega-3 fatty acids. So fish consumption reduces the risk of Alzheimer's dementia. We talked about omega-3. So omega-3 of a fish is a very strong, it's a very rich source of omega-3, and omega-3 is very important. That we saw it when we mentioned what is needed in the Mediterranean diet. Brain lipids contain high proportion of PUFA, that the polyunsaturated fatty acids, and the physiologic role of this omega-3 will include, it regulates cell membrane fluidity, dopaminergic and serotonergic transmissions, so much. And deficiency of these have been observed in persons with dementia. This was a study by Lopes da Silva et al. In 2013. So deficiency of omega-3, because all these are now gene expression, cell cycle control, have been affected will lead to development of dementias. When we talk about a balanced diet, when we're talking about balanced meals and snacks, if we look at our plates, it is suggested that if you divide your plate into 4 quadrants, 4 segments, that one should contain protein, 1 starchy carbohydrates, and the remaining 2 out of the 4. That meaning that half of your meal should contain fruits and vegetables. And this is a balanced diet. We also have to look after our cardiovascular health. You can see that most all the risk factors associated in cardiovascular health problems are also associated with formation of dementias. How do we reduce development of diabetes? You can see all that exercise, majorly, a lot of exercise, eating healthy, and caring for our blood pressure and working out. So preventing type 2 diabetes is one very important way of ensuring that dementia is kept at bay. We've talked about this oxidative damage, oxidative stress. These stress from the environment that cause oxidation that and impinge on the persons will increase the risk of Alzheimer's dementia. And if we also need to increase our antioxidants that we take. Antioxidants are found in vitamins. We talked about vitamin C, vitamin B's, vitamin E, and tea. It's found in green tea, in black tea, and in red tea. Also found in lots of fruit extracts and some oils. We'll manage our blood pressure very strictly, caring for our blood pressure. But many times, high blood pressure are identified when people come for when it's just routinely checked, because high blood pressure does not give you symptoms at the early stage. By the time it starts to give you symptoms, it is advanced. So checking your blood pressure regularly helps to put hypertension at bay. And hypertension is also a substrate for dementia. Being socially connected with the families, connected with non-families, your place of work, and friends generally really is of very high benefit. Interacting with other people is a way that stimulates the brain. And these include attending plays and talking to, discussing it later on, discussing politics with people, attending church services with friends, singing in a choir or playing in a band, orchestra, and even playing games such as Scrabble. These with people, I think this is really becoming very difficult with the social media. People tend not to associate socially anymore. When I worked with CBM, there was a time we attended a program, and one thing we did, because you go out and everyone is playing on his phone. And what we now started doing was we get a basket when we go out and we put all the phones there. Anyone that comes with phone, you put it in the basket, and then we order our food and talk. Anybody that the phone first rings during that eating or at any time before payment of the bill takes the entire bill. If no phone rings, then the bill is shared amongst all the people that went out to eat. And that increased connectivity, social connection between us, amongst us. And a study has shown that older adults who participate more in social activities and who rate the quality of their social support high have been found to have higher levels of cognitive functions, meaning lower levels of cognitive decline, dementia. So social connectedness is really very important, and not just connecting. AI and all these gadgets, social media have actually come to cause more problems to individuals. Handling stress is very important. The way you handle stress and the way you view the viewing stress with some positivity. Stress is okay. Stress is normal. It's a normal thing in life for us to have stress. But the way it is distress that is not good for you. And the way you appraise stress, the way you handle it in your life matters a lot, because you must be stressed. The difference is the way person A handled it compared to person B. All of us undergo stress. In fact, I am under stress currently. In fact, preparing and delivering this discussion was a lot of stress. Of course, it is the kind of stress I want. It is a youth stress. So the way you handle the stress that you face on daily basis matter. The positive way to deal with them can include keep things in perspective and practice assertive behavior. When you cannot do something, say no. You can see the picture by the side. You just accept everything. Your boss gives you, I want this job now, and okay, sir. Another one comes, another one keeps piling up on you, and you are not able to function anymore. So learning to be assertive and saying, I have this, I'm going to finish at this time, and I'm also going to do the next one. So setting goals for yourself, establish clear goals, set your plan your life and say, today when I come, this is the much I can do, so that you don't get yourself stressed up, and when this happens, you're not able to function again, and it is really causing lots of damage into your brain. Also, use exercise to reduce stress. You try relaxation technique. We've discussed relaxation technique on this platform before, where you take a deep breath, sit or lie down and relax, and controlling your attitude. Attitude determines really your altitude. Many things you do will really be from your attitude. Your attitude is really very important. Sleeping for at least 8 hours. It's like the normal sleep time for an adult. It's 8 plus or minus 1 hour in 24 hours. Sleeping enough helps reduce stress and helps reduce development of dementias. It also consolidates memory. It improves your immunity. It is this is just about sleep hygiene. For you to sleep well, you need to turn off your phones. That blue light on the phone really stimulates the brain and make you some sites in the brain that will make you not to sleep properly. So people who use phones or laptops, screens, look at the screens for a long time around bedtime, it impedes sleep. Heavy foods before bedtime is also impedes sleep. Alcohol and smoking and use of caffeine and stress helps to reduce sleep. So you try as much as possible to avoid alcohol. Lots of people think or tell me when I tell them this, that no, alcohol, when you take alcohol, that you sleep. But no, alcohol actually, you may fall asleep, but it fragments your sleep. And you wake up feeling stressed, feeling worse than you when you did not take alcohol. Smoking and caffeine and tea actually stimulates. So we advise that you don't take this 4 hours or heavy exercise or heavy meal 4 hours before sleep. So if your normal sleep time is, say, 10 p.m., from 6 o'clock, it is better to keep these away, and that will help you sleep well. And other things is also having a time set for you to go to bed. Go to bed at specific time and you wake up at specific time. Your biological clock is properly set. It's set at a time that you wake up and that you sleep and you wake up. Taking a walk in the evening helps to relax you. Having a comfortable bed with good bed cover, curtain, staying in a cool and dark environment. Usually your temperature drops a little bit to initiate sleep. And when it's not able to drop because the weather is very hot, you find it difficult sleeping. Also, having bedtime routines like brushing your teeth before you go to bed. When you are preparing, you are also looking at what you have done and putting them aside can be part of your bedtime routine. And relaxing bath. Taking a bath, that helps also to reduce your body temperature, and that will help you go off to sleep. Never smoking or quitting smoking. I like this image that said, stop smoking before smoking stops you. Stop smoking before smoking stops you. There's so much evidence about smoking, that smoking may increase the risk of dementia. Aside what is already known about causing lung cancer, heart attacks, strokes, Alzheimer's dementia is an added risk. So smoking is really something that can be, that should be stopped. It has lots of negative effects on a person. And now, fortunately, there are lots of places that can support people to stop smoking. And it is, in summary, Alzheimer's is a complex disease for which there is no known method for reversing its effects. Once it started, there's no known method currently for reversing it, and there's no known cure for those who have developed the disease. While a large part of our risk for developing this Alzheimer's dementia comes from the gene that we inherit, the good news is that there is evidence suggesting that an even greater part of our risk comes from our environment, especially our lifestyle. Exercising our bodies and our brains, being socially connected with others, eating a healthy diet, learning more positive ways to manage our stress, using tricks to get higher quality sleep, and quitting or never smoking. All these help to lower dementia risk. Again, most people will have this, that people will think that when they hear all these put together, changing your lifestyle in order to reduce your dementia risk, they may think it's so daunting that they cannot do it, because they want to do everything at the same time. No, the best thing is for us to get started. Pick one lifestyle change at a time, work on it, get to a good level with it and master it and go on to the next so that you'll not be discouraged. Remember, many activities you'll find enjoyable and will help you in many areas of your life, like going to work, taking a walk with your friends, going to socialize, sit down, talk, and put your phone by the side. Take yoga class. There's now yoga in Nigeria, the yoga classes that are going on that will reduce stress. Take physical stress and even mental stress. Join a book club that will help in socializing and in cognitive stimulation. I want to tell you that it is possible. The possibilities are endless, and you can make it. Dementia can be put aside. At least up to 60% of dementia, developing dementia, can be put aside by changing our lifestyle. Thank you very much. I try to keep to time so that we'll be able to discuss. I'm really happy to take questions and comments. Thank you.
Wow, 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 wow.
Yeah.
Thank you so much, Dr. Emeka. That was a very detailed, expansive, extensive, thorough, exhaustive, and above all, balanced balanced session you've just given us. Ladies and gentlemen, on this call tonight, I want you to show appreciation to Dr. Nwefo. I can see already people are sending their emojis and their messages. This is awesome. Let me just go to the chat room and read out a few of those feedback. Very educative and wonderful presentation. Thank you, sir. That's from Mr. Adamu Febisola. Dr. Okele says, keep up the good work, sir. Enjoyed every bit of it. Highly enlightening. I totally agree. Dr. Lubodu says, this is awesome. I concur. Very educative by Joy Gua. Indeed, I agree. Thank you. Very interesting. I learned a lot. See, I've been jotting as well. I learned a great deal. And this is like going to school without paying school fees. Thank you so much, Doctor.
Thank you.
Thank you, shared. And
Thank
so much information. I was screen grabbing, I was jotting, I was definitely after now, I'll be going back to watch the recording again, just so to make sure that I do not miss out on any knowledge gap. So again, this is fantastic. If you have any questions on this, you want to ask the question now. Thank you, my mentor. You are wonderful. I learned a lot. Maybe that was one of your students some time past. Nyambo, thank you so much for this awesome, Kelly, amazing lecture. Thank you. I mean, so much. Everybody's just showering accolades and giving you flowers that you thoroughly deserve, sir, without a doubt. Thank you. Any questions from Doctor tonight on this? Because I mean, I love the fact that it wasn't just information that you gave; it was very balanced. So lifestyle, nutrition, and prevention of identification of the major areas we need to focus on. I couldn't help but notice your emphasis on diabetes. So again, if anybody is diabetic, or okay, I see there's a raised hand. What's that? Okay, is the hand raised intentionally, or it's an error? Let me know. If it's intentional, then yes, maybe you want to unmute yourself and speak now. Galaxy S21.
Yeah.
Okay.
It's intentional. Thank you.
Oh, go ahead, ma. Good evening, ma.
Thank you Thank you so much, Doctor. We really appreciate your presentation. It's so packed. I have two major questions. Number one, can younger people develop dementia? There two, from the nutritional point of view, you know very well that these days because of the way the food is being processed, most of the nutrients are not really available, like all the omega-3 you mentioned and all. But we have preparations that were, intentionally prepared with this omega-3 in their really, really effective form. We have the antioxidant, like our key product, aloe vera gel. It's our signature product, but it's one of the most powerful single source antioxidants. I'm just wondering why we cannot recommend this for our people to prevent dementia, because at least we'll be sure they are getting enough of all these antioxidants and omega-3 you mentioned, vitamin B in our royal jelly, So all that they really need, we can be sure that they will get them from our organic food supplement. They are not drugs, they are not synthesized, but they are just freeze-dried, and then omega-3 is cold processed. Unlike when you extract omega-3 with heat, you denature it, and many of us eat our fish cooked. So I just want you to throw more light on that. Thank you very much. It was really, really, really great presentation. We appreciate you. Thank you.
Thank you so much. I feel so good. I feel glad to hear from you, to hear this. Thank you. Yes, dementia can occur at any age. In fact, I also told you that there are reversible dementias. Head injury can cause dementia, HIV can cause dementia, there's just too many things. Even Alzheimer's too can be seen in people as young as 40 years, but it is more in the elderly. The risk of developing dementia, Alzheimer's dementia, which has been studied so well, more than others, in the general population is about 1%. So 1% of the population will develop it generally, but by the time it gets to 65 years, it goes to up to 3%. So 3%, and by the time it gets to 80 years, people that get to 80 years, it can get up to 20% of people in that age. So it just increases the prevalence, and the better the healthcare system is, which we're experiencing, we're having longevity more. With better healthcare system, there is increased longevity, and dementia prevalence will also increase. Yes, it can affect anybody at any age, but it's more among the elderly population. I agree with you. Yeah, I know that method of preparing our food, especially when we cook it and cook it so much, really denatures most of the nutrients. In fact, for some in our communities where you keep warming the food, they are not, well, some eat fresh. If it is eating fresh, yeah, that's where, and not overcooked. I also agree that there are antioxidants that is found in fruits. It's also prepared ones. Those ones are also encouraged. We encourage people to take those preparations to supplement, especially when feeding, of course, when feeding the food, the nutrients are usually not there, or they are denatured, or they are elated in during cooking or preparation. Yeah, so I agree with you. Thank you.
Fantastic. Thank you for that. I mean, you mentioned the supplements.
Thank you.
Thank you.
Fantastic. There's another hand here, Adamu Fedisola.
Yeah.
Are you ready for us? You can unmute yourself and ask your question, please. Can you speak up, please?
Good evening. Hello,
okay,
good evening. Can you hear me?
Yes, please.
Yes,
Yes, please
Adamu,
go
we
on.
can hear you now.
This is Adamu Febishola. Good evening. Thank you very much for that enlightenment. It's so educative. Please, I want to ask, there's this home remedy we were doing during the COVID era, and I think it's gradually creeping into our diet. This cloves, ginger, turmeric, this other one that has this brown stick, cinnamon. As an antioxidant, how effective is it as an antioxidant? Those home remedies, probably soaking it in water or brewing it as tea, blending the ginger, brewing it and then sieving it and drinking like an antioxidant. How effective is it? Thank you.
Thank you. Yeah. Really, most of those that we used then, of course, probably we were just using it for other purposes during COVID. But it depends on what they are. Oranges are good. Ginger is good. Depending on you, we may have to look at them individually.
No, I mentioned cloves. This
okay,
local
yeah.
clove, Bonofuru.
Truly, I don't know that. I'm not.
Yes.
Ginger, garlic, right?
Okay. Yeah.
Yes.
Okay. Ginger. Okay. Yeah. Ginger is very good. Garlic is good. Those are good. But I really cannot determine the antioxidant effects that the one that we have here, that I grow here. I really have not researched on them. And I may not be able to tell you categorically that what antioxidants they contain. And yeah.
Thank you.
Yeah, thank you very much. Yeah.
Thank you. I'm sure that maybe Mr. Perry may want to come back to address that. The little I may want to chip in is many of these spices, if you like, they tend to become more bioavailable in the presence of certain other ingredients. So your body may not be able to maximally or optimally absorb some of those ingredients, except it is presented in a certain format. So even though you're presenting the right antioxidant to the body, it may not optimally absorb it, except maybe when a question may come back later to share. But right now, let's give room to Joy Goa. Joy, you've been raising your hands for some time. You can have the floor now.
Yes, good evening, everyone. Good evening, Dr. Emeka.
Good evening, Joy. Wow.
Thank you so much. I really enjoyed the lecture.
Thank you. I'm so glad.
Yes. Knowing that dementia cannot be effectively cured, I'm wondering, how do you counsel caregivers who present with their patients for medical care? Like the case you presented. So what is the best counsel? What's the best advice? Because I'm a clinical psychologist. I work in a psychiatric unit and we see these cases. So what do you think will be the best way to counsel patient caregivers and to reassure them that, okay, they'll be fine, even in the midst of the problem?
Thank you. This is really great. I'm glad to hear this. And I know this is coming from you. It's really important. Yeah, caregiving in dementia is really difficult. Caregiver burden is one thing that has been studied so much, and it has, in fact, it is really gaining a lot of momentum, a lot of attention out there. It is very difficult. It can be caring for a person with dementia can be likened to caring for a person with stroke, because someone and this person, because they can just throw away. In the night, there is what we call behavioral and psychological symptoms in dementia. that they can just be screaming in the night. They don't sleep. They may have reversal. They sleep during the day and don't sleep at night and disturb everyone at night. It is very tasking. And this is where we have advised, of course, we advise as much as possible that people should stay in their homes. But in this case, where the burden is so great, we allow either respite homes, or taking the person to a central place in a community where they can meet with other people. We also have ways of reducing the psychological and behavioral symptoms in dementia by using some treatments, some medications. And there is also maybe care home. The relation should take turns, have respite, so that they too don't break down, because we also are interested in the healthy living of the caregiver. Their mental state is also very important, not just the patient. And because of this, a lot of people, elder abuse has actually been increased from this difficult caregiver body. So one, they can get some respite, they can change, you can get some help, people coming to support them in the house, so that they also have take some breathe, some fresh air, and have some respite, because staying with them, only one person cannot care for a person with dementia alone. If you do, you will break down. The stress is enormous, and they can really break down and have more problems. So changing them, having respite, taking sometimes daycare to somewhere where they can meet other people, or take them to another home where someone will support them, take care of them, or change staff. You can get 2 or 3 staff that will be there if you can afford it, but I know that it is a very difficult task. So that is the major thing. If we can, what we're advocating is prevention now. That is why it's really important that we prevent occurrence of this, which can happen in 60% of cases, up to 60% of prevention, rather than getting to the point of treatment and caring, very severe burden of caring for these people. I hope I answered your question, Joy. I can still
Thank you so much. No,
oh.
Thank you so much.
Thank you so much, Joy. I'm glad you were able to make it. Yeah.
Okay, we have 2 more questions, and it will be a wrap. Nana Musa, you're up next. Please unmute yourself.
Hello, good evening. I think I joined this lecture at the middle or close to the end, and I didn't quite. Can you all hear me?
Yeah, yes, please. We can.
Okay.
Yes, can hear you.
Towards the end, it's not that I really have a question. I just wanted to comment and maybe piggyback to what the presenter said about when someone asked about cloves. My understanding, I may be wrong, but that's my understanding of clove, is that it's an antimicrobial agent. It helps like an antibiotic, and it helps with bacteria, to help kill some bacteria, and also including E. coli, bacteria like E. coli and some other bacteria. I just wanted to add that to it. And also with the other question that someone asked about what the caregiver can do with someone with Alzheimer's. I think the number one thing, patience. Patience is a big one. One has to be really, really patient to be able to take care of someone with dementia, Alzheimer's. Like you said, that it's really stressing, taxing, And also, like elopement precaution, keep an eye, like he also said, also to get more caregivers to be able to help out to prevent burnout so that people don't get burned out while they're caring for their family members. And I'm not sure, like I said, I joined the lecture towards the end. Like most people with Alzheimer's and dementia, they remember stuff from the past than the present. Sometimes they refer to the past and they don't remember what's currently happening. They can talk to you about when they were much younger than where they are currently. And sometimes not arguing with them and agreeing with them and just following through sometimes helps to relieve calm nerves. And I'm not sure if there are associations or places where one can get help, help in the sense that like a group of help where people can come together who have family members that suffer from dementia and Alzheimer's to see how they can all interact and help one another to rub minds together to be able to relieve some of the stressors. I don't know. I'm just, I'm asking. So thank you so much too. It was fun. It was enjoyable.
Thank you so much. That's really quite interesting. Thank you. I agree. You've really made a lot of points. I am happy to hear you. Yes, I also am not very sure but I know there was a place around in Abuja when I was there. There's a place in one of the communities that people were meeting. People as caregivers of persons with, well, that was not specific with dementia, but with mental conditions. And some had one or two of persons with dementia, and they planned to segregate these into different groups with time. I have not followed up to see what has happened, but that really was good. It was a kind of self-help group where they were lumped together, and that they come together to relieve stress, relieve tension, and discuss how they're able to support each other and or learn from the experiences of others on how to care for these persons with these disorders. I believe, I'll find out if they have moved on, if they have been able to do what they said they would do, segregating persons with different types of challenges, and that's carers of people with different types of challenges. They also have Al-Anons, that's wives of, but that one is in Lagos, wives of women, wives of men that use alcohol, misuse alcohol, or Latins. All those are really coming gradually into our community. But I think if it really would be nice if some people would take it up and try to develop that to reduce the stress faced by these people, the distress that is faced by caring for the persons with dementia. Thank you. Thanks for your contribution. So interesting.
Thank you. Thank you so much. And the final question for tonight will be from Dr. Olubodun. Dr. Olubodun, you have the floor now. Unmute yourself and ask your question. Dr. Olubodun with us, or should the opportunity pass on to... Okay, more for Michael. If you're with us, please take the opportunity and have the floor. Thank you. Dr. Olubodun or more for Michael, any of you, because of time, okay, I guess that we'll just wrap it up here right now then. Okay, so let me just, on behalf of the Happy People group, by the way, this meeting has been put together by the Happy People group. We are a group of professionals, entrepreneurs who are interested in making people happy. And we do that by giving them information regarding their health. We believe that healthy people are happy people. Get into a hospital, you will hardly find anyone who is confined in a hospital who is happy. So we want to make, want to transmit and emit and cause happiness to radiate, and we do that by sharing information such as this and creating a platform so we all can be enlightened and be happier for ourselves. And of course, we do this also by partnering with a US multinational who are always been involved in the manufacture of the purest, the most pristine quality supplements in the world for the past 45 years. And that is the company that is known as Forever Living Products, also known as the Aloe Vera of America. And while Dr. Emeka was sharing about supplements and food that we may take to help to deliver optimal cognitive or cognition, then there are a few that I would like to mention that you may want to try out for yourself. Highly recommended, as a matter of fact. Number one will be the Arctic Sea, Forever Arctic Sea. That is the omega-3 fish oil. And we have a unique blend of fish oil that provides with a perfectly balanced omega-3 supplement with fish, calamari, and high oleic olive oil, all in one. So it delivers omega-3 and others as well for cardiovascular, digestive, immune, and of course, brain and visual function. We also have the Forever Daily. He talked about the B vitamins. Forever Daily contains all of those B vitamins, include, of course, the B12 as well. Forever B12 Plus contains all of the essential B vitamins, and the Forever Daily contains a broad chain of vitamins and antioxidants, minerals as well, that you will do well to reach to the person who may have invited you to this meeting tonight to make inquiries about how to lay your hands on these supplements for yourself and for your loved ones. Prevention, they say, is better than cure. And so we want to encourage you. Doctor has enlightened us tonight and showed us how that though dementia is more prevalent in aged people, it can also happen with younger people. Let us take control and take charge of our health by taking preventive steps today so we can be happier and healthier for longer. Thank you once again for your audience tonight. On behalf of the Happy People Group, I'd like to thank you for your audience and want to say have a wonderful, wonderful, wonderful night. I will see you again at the next meeting. Thank you. God bless you. Good night, everybody. Good night.
Thank you so much. Bye-bye.
Thank you, Doctor. Oh, you asked for the access of the clip. The clip will be available. If you talk to the person who invited you, I'm sure they will get the clip to you as soon as it's made available. Thank you all. Good night.